We are here with Dr. Zuri Murrell. How are you?
Fine. How are you today?
I'm very good, thank you.
Excellent.
As you can see, he is a very important doctor. Look at all of these, accomplishments.
I'm the medical director for the colorectal cancer program here. But you talk about all of the awards and everything. But the ones I'm really the most proud of is really the community service, because to me, a lot of times the medical field, medical problems, and especially the disease that I deal with, can be very daunting and very embarrassing and very challenging for patients. And so I really pride myself, in addition to being what I think is a good surgeon, being able to get out in the community and kind of trying to make people feel comfortable about a problem that exists that many people are embarrassed to talk about, and that's colorectal cancer.
Yeah. Unlike myself, who's not embarrassed.
Exactly. You're very rare, but you're exactly, and I don't know how this sounds, but you're what it needed. You're what somebody who is outgoing, who's not afraid to talk about their experience and to show how great the outcome is for a large number of people.
Yeah. I was lucky I got that one, because breast is pretty much covered.
Breast is covered, and we're still making new, discoveries every year, but breast now is not a dirty word, and that's the NFL players talk about, breasts.
They're wearing pink right now.
They're wearing pink right now, right?
That.
And colorectal cancer is actually the number 2 cancer killer, in America.
Yes.
Number 1, and it's the 3rd most common cancer, and this is of men and women.
Right.
But it's still yet to get that kind of national attention, I believe, that it deserves, and I think part of it is because of the very nature of it.
The body part.
The body part, and the word rectum. And so rectal. I always encourage everybody to say colon, say rectum, say anus. You got to get over these words. You got to get over these words.
Yeah.
And as soon as we can make those words like breast,
and
I think we'll be making serious dents in this disease.
We're gonna make some dents.
Exactly.
And I've given it my own words, like booty, bootylicious,
exactly.
Back end, backside,
right.
The word, that other word, the A word.
Yes. Yes.
But, back at you,
right.
I have had a lot of fun with, in the midst of the pain and agony of having colorectal cancer, been able to laugh a lot about it, because I think that's a huge part of healing, is laughter.
And I think when people say colorectal cancer, they don't think of somebody like you.
No.
They think at all.
I didn't think of somebody like you.
Right, but even when you're done, even when you've been treated and everything, they don't think that they can look like you, and they can. And people are walking around and they are healthy and they have survived it and they're continuing to survive it. And it's not the reason I went into this field is because it is not a death sentence. There's a lot of cancers, unfortunately, which while we made a lot of strides, but they are a lot of times fatal.
Right.
With this. First of all, I don't believe people ever need to get this disease, number 1. But number 2, if we catch it early, you can actually still cure people.
Absolutely.
And you can cure a majority of people if you catch it early. And that's what attracted me to this diseise.
Yeah.
Which is kind of the paradox.
Saving lives.
Exactly. Yeah. Saving lives and doing something that you can actually make a dent in, which is still, it's kind of a paradox, because it's mind-blowing to me that we are still, and we being Americans, are still dying from this disease at such a high number.
Yeah, it's not necessary.
It's totally unnecessary. And so that's why this is my passion.
Yeah, you're good at it.
Oh, thank
He's
you.
got a lot of spirit. This one, not your typical surgeon. If there's a stereotype.
Right.
When I first met you, I was like, wow. I'm like, oh, that's the surgeon. I got to connect with him. Oh, that for sure. So, I love your passion, and I love your willingness to go out there and, you can just come here and do your job and leave, but you do so much more, and it's inspiring. It's inspiring to me.
Thank you very much. Well, you inspire patients all the time, so I think that's what's great. If I can encourage people to just talk about this at the dinner table, basically talk about what we eat, talk about and actually even getting the knowledge, right? So you need to eat fiber. Need to drink water. All of that can help decrease our risk. But the number 1 thing that we need to do really is get screened.
Get checked.
Get checked.
Check yourself before you wreck yourself.
Exactly. And that's what we need to do.
Yeah.
And I think that people, if it's not proposed to them by their doctors, then people often don't bring it up.
Of course not.
And they need to, and you need to be your own advocate. And that's really the key, I think, with both of our passions, is making sure that you as a patient, as a person, need to really be your own health advocate. And what does that mean?
Right.
That means if something changes, so number one thing, changes in bowel habits.
Right.
If you're the kind of person that goes and has a bowel movement once a day, and all of a sudden
Right.
you're going once every 3 days, that's a change of bowel movements.
Right.
That's something that needs to be brought up to your doctor.
Right.
Okay, or vice versa. If you go once every 2 days and all this, or once every 3 days, and now you're going every day, multiple times a day,
That's
change
a problem.
That's a problem. So it's the changes. If you start having abdominal pain, you know, and you know it doesn't pass after a few days, and it's getting intense and more, and you know, causing more and more distress,
Right.
you need to actually seek medical attention.
Right.
Now that's just one half of it.
Right.
The other half is knowing kind of what to expect. When you see your physician, there should be a plan. The plan should be, we're going to try this. If it doesn't get better, then this. If
Yes.
it doesn't get better than this, then we're going to evaluate. That should be the natural progression, and that is something that you, as a patient, should insist on.
Right.
It shouldn't be,
Yeah.
well, we tried this. Let's wait another week. Let's wait another week. Let's wait another week. You know, and because the weeks turn into months, turn into years, and
Yeah.
like I said, the key with this whole disease
It's
is to
getting it.
actually getting it early.
Yeah.
And you know, there's really only 2 tests I like to say in all of medicine that we do to people. We draw blood, we do CT scans, we do a ton of tests, spend a lot of money, but there's really only 2 tests that prevent cancer, right? And one is Pap smear, which women have been getting since teenage years,
Right.
because you see changes on the cervix and you're able to remove any cells that have these changes before it becomes cancer.
Okay.
And number 2 is a colonoscopy. Colonoscopy, as I love to tell patients,
Yeah.
is not done to find cancer. We don't do it to find cancer. We do it to prevent cancer. If you're finding cancer, you can find it early, but we do it because you see a polyp. Colorectal cancer starts from polyps.
Okay.
Most polyps, like i.e. greater than 90%, you can actually take out at the time of colonoscopy
Right.
before it even becomes a
Right.
cancer.
Before it grows into
Before
the
it grows,
cancer.
right.
Yeah.
So that's one of the big reasons people don't get colonoscopies a lot of times is they're afraid, oh, we'll find cancer. Okay, so number one is most of the time you don't, most of the time you prevent cancer.
Right.
Number 2, you find it, but you find it early and you're able to treat it. And what's even more amazing about this particular disease is that even if you find it late, so sometimes, you know, unfortunately, we find it in patients and it's in the liver and it's in the lungs,
Right.
but patients can still live a long time now with surgery,
Yeah.
chemotherapy,
Yeah.
and they live well. I mean, your experience with chemotherapy, I know chemotherapy is not easy, but was it what you thought it was going to be?
No, it was way worse.
It was way worse, okay.
And I would say that to Dr.
Yeah.
Becker. I'm like, this is way worse than you said it was going to be.
Mhm.
But once I acclimated
Mhm.
and they adjusted, you know, my cocktail,
Yeah.
and I understood what the process was and, you know, how each week was going to go, then it did get better.
Mhm.
Because like mentally I was prepared, emotionally I knew it was going to break down, and then I could deal with those side effects much more efficiently
Right.
than, I mean, part of it is like not knowing.
Exactly.
And being the person I am, I'm like, oh, nothing's going to happen. I'm going to have
Right.
side effects. It's going to be a problem.
Right.
And then, you know, literally 1 minute I'm up, and then I was like, boom,
Down, right?
down. I was like, oh my gosh, like this is serious. And then I got toxicity. I ended up in the hospital.
Mhm.
And that was troubling for me, because I'm like, oh my gosh, maybe I'm not accepting the chemo. Switch that whole mentality around and said, you must submit.
Yeah.
Can you explain the stages? Okay, first of all, there's anal, rectal, colon. Is that how it goes?
Exactly.
And,
So
yeah, tell me.
So colon. So we'll start with colon. So colon and rectal tends to be kind of geared together. However, we do treat them a little bit different. So
Okay.
when I tell people, everybody thinks they're the same, but when I say colon, the number one job of the colon is actually to reabsorb water. Okay.
Okay.
So everybody thinks it's to make stool, to make poop,
Oh yeah.
but actually it's the byproduct
Oh.
of what happens. So when you eat food, basically your stomach breaks it down, your small intestine absorbs what's needed, and then things get into the colon. The colon reabsorbs water, and the stool that's in the colon, things that's the waste, things that the body doesn't need, that is then excreted to the rectum. Okay, the rectum's job is to hold the stool until a advantageous time to have a bowel movement. The anus's job is to decide whether or not you're going to have a liquid bowel movement, you're going to pass gas, or you're going to actually have, liquid regular bowel movement. Okay, so everything has
Anus
a job.
has a big job.
Anus has a job. Anus is the only, we like to say it, but the anus is the only muscle in the body. When people say, why'd you go into colorectal surgery? I say, because I'm smart. And they always say, what do you mean? I say, well, I mean, think about it. The anus is the only muscle in the body that can differentiate between liquid, solid, and gas. And it is. And
I did not know
exactly.
that.
And so the colon typically then presents with. So when you have a colon cancer,
see what you can learn.
See what you can learn. There's always something we can learn, right? And so the colon reabsorbs water. Colon is large, right? Literally, it's called the large intestine because it's actually large.
Yeah.
And it's about 5 feet.
It's
and
long.
It can grow, and so why is that important? The problem is that if you have something in the colon, when it's small, it's hard to diagnose it. Like you wouldn't know necessarily.
Okay.
When you start actually having symptoms like abdominal pain and things like that, then it's usually really large, or it could even metastasize. That's why we do the screening. That's why colonoscopies are done. Now, you have to remember with screening tests, everything costs money. And it's not how much money the doctor charges, it's the money in the system, okay?
Yes.
And so screening is meant to test the largest number of people for the cheapest price, right? You have to remember that. And so that's why guidelines are what they are. Guidelines are 50 because they don't think there's even enough people to do colonoscopies for, if everybody actually got what they needed, they meaning that the societies, there may not be enough physicians to actually do all of that. That's why, which is, and most of the time if you're 40, you don't get cancer, right? So the whole issue is you have to remember that percentages are fine. If I tell you that I have a surgery that's going to fix you, except if you're in that 1%, it'll fix you 99% of the time. If it doesn't fix you, it's 100% to you.
Right.
You understand what I'm saying? So, so guidelines, you can fight guidelines, meaning that if you have changes, you need to go ahead and push for a colonoscopy.
Right.
That being said, so anyway, the colon, the most common symptom of colon cancer, not rectum, but colon cancer is actually like diffuse abdominal pain, non-specific. Things that aren't getting better and change in bowel habits, okay? Now the rectum, I just said that the rectum's job is to hold the stool, okay? And so the rectum is lower down.
Okay.
The most common symptom of rectal cancer is actually bleeding,
right?
Okay, and often it's painless bleeding, which is also the most common symptom of internal hemorrhoids. You make it a livable disease, meaning that every once in a while, and that's really the goal. It's interesting. There was a Chris Rock joke a long time ago talking about we got to the point now with AIDS where it's like he hopes to get to the point with HIV and AIDS that, hey buddy, why weren't you at work today or yesterday? Oh man, my AIDS was acting up. I took some Robitussin and now I'm all better, right?
Right.
That's what we kind of do with stage 4, and that's my goal is that hey, why were you at work? You every once in a while, because once it's theoretically in the lung and the liver, we haven't been able to pinpoint how to kill every single cancer cell without doing damage, right? To everything else. So every once in a while, cancer may pop up, and you treat it. You chemo, surgery goes back, goes away, and you make it a livable disease. Okay. And so usually, that's what I tell my stage 4 patients. I say, look, we're getting to the point now where you can still live a long time, but you're going to go through phases where everything will be gone, and you'll be very happy. And the first time it comes back, because it probably will come back, but it won't kill you. That's the key,
right?
And so I'm very honest with them. Stage 3, we still cure it. We can still cure you, and that's the issue. And worst case scenario, especially somebody who's gone through stage 3, is that you're getting so many screenings, so many tests that if it does pop back, it'll be very early. And you just knock it out.
You're on it. And also, I did 12 rounds of chemo, right?
Yeah.
I think total.
And that's also because of your age. You're so young that they gave you a little extra.
Yeah, I didn't want to leave. I'm like, can I come in once a week just for a little pick me up?
Yeah, right.
Like, no. But I'm like, okay, some people that I know didn't do that, and I'm like, why wouldn't you? And they're like, because it's too much. I'm like, it's like doubling down. Like, you're in Vegas, you're like, maybe that's enough, but I want all of it. I want to make sure.
Right. Well, then the toxicity of the the chemo, you have to look at it that way also in terms of, we don't want to do anything that can cause, permanent damage and all of that. But it depends. I mean, it's different. We're getting really good now with molecular markers now.
Right.
And so molecular markers can portend whether maybe this chemo is going to work for you. Maybe you do need a little bit more. Maybe you need a little bit less. So that's kind of like the future right now, to try to kind of decide what is best. But then I also tell some patients, some patients, they're not, the chemo affects them in such a way where, they can only do, they give it their all, and they try to, and they can only do 4 or 6. And so, and that's, I try to give them the pep talk, but if not, I try to let them know, at least you did that. You know what I mean? So.
Yeah, feel comfortable.
Exactly.
So I would like to just end it up or wrap it up with saying, when you were saying like cancer sucks and all of this, it does, but there is a complete other side of it. You meet the most amazing people like yourself. You have wonderful support, usually immediately.
Yeah.
And you learn a lot about yourself. I mean, you learn a lot about who you are and what you can, what you're capable of doing. And
Exactly.
for somebody like me, who's like, I like to be a helper. I like to do things for others. And I'm used to like, setting a goal and reaching it. So for me to be down like that and to ask for help, like, what a great lesson,
Right.
for me to learn that.
Right.
And it's just so many random acts of kindness that I experience and the relationships that I have now. It's like a backwards blessing.
It is, right. Well, that's what I tell you, is that you never know how strong you are. And I'm always impressed, and I learn something from my patients every day about their strength and the sheer power of positivity.
Yes,
and it's sad that
it.
we have to sometimes go through that. And I have, in order to feel that, like, it would be nice if you could wake up every morning. We always say that you have your health, you have everything, right? But most of the time, that is when you've gone through something when you don't have your health.
Yeah, People will tell me about their problems. I'll be like, wrong audience.
Yeah, and I forget too, right? And I forget too. Sometimes I complain, and then I realize that when you have your health, you can literally, there's really nothing
that you can't do.
That you can't do, right? But you don't realize that until that happens to you, or you're surrounded by that and all that. And you know what? I mean, you're a testament to that. So.
Yeah, well, it's the first time in my life I've ever been completely out of control.
Mm-hmm.
Like am I gonna live or am I gonna die? And I don't know. Like this is like. It's the doctors, it's God, it's like everything has to come together for me to live. And whoa, that was a huge awakening for me.
Right. But you know what? You dealt with it probably how you dealt with everything else after some time, with positivity and energy of
It's imperative.
Focus.
You have to listen to him.
Definitely.
Okay. Any last? Tell us again what you said.
This is the last thing. I always say that once again, you guys, you should not die from fear. You should not die from embarrassment. Get this test. Get your colonoscopy. Be in tune with your body. It's very important. It's very important. And like I said, it's done to prevent cancer. And please, once you get it and you realize how easy it is, talk to people about it. Mm-hmm. Ask them if they got your colonoscopy. If you don't want to ask a stranger, that's okay. Ask a family member. But this should be something that is discussed at the dinner table with family. And kids out there, ask your parents, have you had your colonoscopy? Okay? It's very important.
My kids ask me.
There you go. Excellent.